Okay, one of the Bone and Joint Health Strategic Clinical Networks initiatives addressing the vision is the Catch a Break program. The Catch a Break program is led by the Bone and Joint Strategic Clinical Network and supported by HealthLink Alberta and the Alberta Bone and Joint Health Institute. So the goal of the Catch a Break program is to improve awareness of osteoporosis, educate patients and primary care providers on screening and treatment options, and change behavior related to osteoporosis medications, supplements, and modifiable risk factors, including alcohol intake, smoking, and exercise. Alberta data shows currently that 80% of people over age 50 who suffer fragility fracture are not assessed or treated for osteoporosis. And this is the goal of the Catch a Break, is to change that demand curve and start to address osteoporosis. Basically, HealthLink Alberta will contact all patients over 50 years of age who have suffered a fragility fracture and do a screening with them to identify if they might be at high risk for osteoporosis. If we do feel that they're at high risk for osteoporosis, we send them some educational material around exercise, diet, nutrition, and we also send a letter to their family physician notifying them that their patient did suffer a fragility fracture and that we encourage them to follow up with that patient. But we also ask the patient to contact their family physician and set up a follow-up appointment with them. The Catch a Break program then contacts patients at 3 months to identify, have they seen their family physician? Has there been any treatment initiated? Have they received any BMD testing if appropriate? If they have not seen their family physician, then we let them know that we will be contacting them again at 6 months to follow up with them, because obviously the goal of the program is to start to change behavior and awareness around osteoporosis. At the 6 month mark, when we contact them, again, we look to see if they have followed up with their family physician. If they haven't, we again follow up at 12 months. All patients are contacted again at 12 months to do a follow-up, and that follow-up call is really around finding out if any behaviors have changed. So have they increased their vitamin D and calcium intake? Are they exercising more regularly? Have they reduced their smoking? Has any osteoporosis medications been started? From there, we do a preliminary evaluation of the program to determine effectiveness. And in the first year of the Catch a Break program, we actually have seen an increase in osteoporosis medications being prescribed and taken by patients. We've seen an increase in bone mineral density testing for patients. And we've also seen an increased follow-up for people to their family physicians. So when we started the program, when we looked at that program, we saw 73% of patients who we initially contacted had seen their family physician. On follow-up, we were at 85%. So what we feel as though is that we're starting to change the way people approach osteoporosis, and they have the opportunity to make them more aware of the treatment options available.